this video, we will discuss capillary hemangioma. Capillary hemangioma is the most common tumor of the orbit and periorbital area in childhood. Girls are affected more commonly than boys. It may present as a small isolated lesion of minimal clinical significance or as a large disfiguring mass that can cause visual impairment and systemic complications. Pathology. An established tumor is composed of anastomosing small vascular channels without true encapsulation. It is a hamartoma, a disorganized overgrowth of mature tissues normally present in the involved area, and believed to be due to endothelial cell proliferation. Epidemiology. Approximately 30% are present at birth. Incidence of infantile hemangioma is about 5%. Associations. Large or multiple lesions may have associated visceral involvement, which can lead to serious complications such as thrombocytopenia, as seen in Kasabak-Merit syndrome, with up to 50% mortality. And high output cardiac failure and systemic investigation should be considered. If a large facial hemangioma is present, face syndrome, which includes a range of possible systemic features including eye involvement, should be considered. Clinical presentation. The lesion is usually noticed by the parent, usually in the first few months of life. A superficial cutaneous lesion is bright red, called the strawberry nevus. Preseptal or deeper tumors appear dark blue or purple through the overlying skin and are most frequently located superiorly. A large tumor may enlarge and change in color to a deep blue during crying or straining, but both pulsation and a bruit are absent. Deep orbital tumors give rise to unilateral proptosis without skin discoloration. Hemangiomatous involvement of the palpebral or forniceal conjunctiva is common. Additional hemangiomas on the eyelids or elsewhere are common. Natural cause. The natural cause is characterized by rapid growth 3 to 6 months after diagnosis, followed by a slower phase of natural resolution in which 30% of lesions resolve by the age of 3 years and about 75% by the age of 7. Investigations. Imaging is generally performed for other than very small lesions, mainly to rule out more extensive orbital disease. Ultrasound shows medium internal reflectivity. On MRI or CT, the lesion appears as a soft tissue mass in the anterior orbit or as an extracornal mass with finger-like posterior expansions. The orbital cavity may show enlargement, but there is no bony erosion. Indications of treatment. Treatment is indicated principally for amblyopia secondary to induced astigmatism, anisometropia, occlusion or strabismus, and less commonly for cosmesis, optic nerve compression or exposure keratopathy. Medical treatment. Beta blockers. Oral propranolol is now widely used. The prescription and monitoring should generally be carried out by a pediatrician. Topical preparations including timolol are equally effective with excellent long-term results and no systemic side effects. Injection of triamcinolone acetonide or betamethasone into a cutaneous or preseptal tumor is usually effective in early lesions. Regression usually begins within 2 weeks, but if necessary, Second and third injections can be given after about 2 months. It is advisable not to inject deeply into the orbit for fear of causing occlusion of the central retinal artery due to retrograde introduction of the suspension. Topical high-potency steroids such as clobetasol propionate cream are sometimes appropriate but are slow to exert their effect. Systemic steroids administered daily over several weeks may be used, particularly if there is a large orbital component or a rapid onset of action is required. Other treatment options. Laser may be used to close blood vessels in superficial skin lesions less than 2 mm in thickness. Interferon alpha 2A and vincristine may be used for some steroid-resistant sight-threatening lesions. Local resection with cutting cautery or carbon dioxide laser may reduce the bulk of an anterior circumscribed tumor, but is usually reserved for the late inactive stage unless a resistant tumor is sight or life-threatening. To summarize, capillary hemangioma is the most common orbital tumor of childhood. It has a strawberry nevus appearance. It enlarges with crying or straining. It is characterized by rapid growth, then spontaneous involution. Propranolol is the first-line therapy.